Hi, I am an aviation medical examiner, and I'm here to help guide you through what to expect during our FAA medical exam and how to prepare for it. Whether you're a seasoned pilot or applying for your first medical certificate, being well prepared can make this process smoother and faster. I love being a physician, and I'm a vascular and interventional radiologist, and I specialize in minimally invasive surgery to fix vascular problems and treat cancer. But I always wanted to fly, and 10 years ago, I finally got to do it. And I love everything about aviation. I love airplanes, I love flying, and I love where it can take you. But I mostly love the community, and I would recommend everyone to do it. And that is why I became an AME, so I can help other pilots to live their dreams. First, let's talk about what is the FAA medical exam and why it is required. I think it's pretty obvious that the FAA mandates medical certification to ensure that all pilots meet the physical and mental health standards necessary to fly safely. So not only passengers, but other pilots and people on the ground are safe. And depending on the type of flying you plan to do, you will need the first, second, or third class medical certificate, each with its own specific requirements. So how long each certificate is valid? A first-class medical certificate is only required if you're an airline pilot, and it's valid for 12 months if you're under 40 years old, or for 6 months if you're older than 40 years old. And once the first class expires, it's automatically downgraded to a second class for a period of time, and then eventually a third class for another period of time. So a second-class medical certificate is required for commercial pilots if they are working for hire, for example, in a charter business or a crop dusting business or a professional airplane photography business or even carrying people to parachute. A second-class certificate is valid for 12 months for all ages, and after that time, will revert to a third class. A third-class medical certificate is the most common one, and that's the one that every pilot that flies for fun or for commuting need to be able to fly. And it's valid for 5 years if you're under 40 years old and 2 years if you're older than 40 years old. The only exception to this is what I mentioned before, which is if you are under 40 years old and you get a first-class medical certificate, you get as a bonus a second year of the second-class medical certificate. So my job as a medical examiner is to review your medical history and perform a physical exam and determine if you meet the FAA standards. I don't make those standards. And these standards are actually outlined pretty clearly in something called the AME Guide, which is available to anybody in the FAA website. And you can just Google AME Guide and we'll take you to it. In there is a lot of good information and we'll tell you exactly what the FAA is looking for and what they will require. My job is to make sure you make the requirements. And if you don't, my job is also to guide you so eventually you can get your medical certificate. The goal of this process is not to ground anybody, but to ensure that everyone's medically fit to fly safely. Now, by preparing in advance and sharing any relevant medical information with me, we can work together to address potential issues and streamline the certification process, making the entire process a lot quicker for you. So how can you prepare for this examination? So the first thing you have to do is to complete the MedXpress application, which is an online form that anybody can go, it's free, and you can go to the website medexpress.faa.gov. And it will probably take you 15 minutes to half an hour to fill that application, unless you have a lot of medical problems that will take longer to write everything down. At the end of the application, they will give you a confirmation number and they will also email to you. And it's important to write down this confirmation number and bring with you to the visit. And you can also send the confirmation number to us ahead of time through our messaging system, which we'll get to it. I work with a system called My Health Online, where you can message me and my staff directly, making communication a lot easier. So to make the process more streamlined, I would ask you to sign to that messaging system at mho.sutterhealth.org. And there you will need to verify your identity. But if you're having problems, my staff will guide you through the process. I'm also going to put a link to another video that describes this process in the notes of this video. Once you sign up to My Health Online, my office will send you a message with instructions, and you can reply to this message with information or questions. It is very helpful to everybody if you send us a message ahead of your visit with a list of your medical problems and medications you take. If I review that in advance, I can guide you on what documentation you need to bring, including medical notes or laboratory tests or imaging tests. This is especially important for conditions like heart diseases, diabetes, or mental health diagnosis. It's also important to tell me ahead of time if you have something called a SODA, which is a statement of demonstrated ability, or if you have any type of special issuance for some type of medical condition. Of course, you would only know about a SODA or a special issuance if you had an FAA medical certificate before. So if it's your first time, don't worry about this. So it is important to be transparent about your medical history. Not only because it's the safe thing to do, but also because if at some point the FAA gets a hold of your medical records, and if they find that you did not disclose something in the past, it may also make your life a lot harder. Now that we're talking about disclosures, it's also extremely important to disclose any police records or especially DUIs, as the FAA has access to that information. And if you lie in your application and they find out, they will make your life a lot harder. Trust me, I've had patients that did that, and it took a long time for them to get the license. Most of the time, they will end up getting it, but it will take a lot longer. Now, if you disclose, it may take a little longer than normal, but eventually you'll get it too. Now, once you're coming to the visit, I would recommend avoiding caffeine and heavy meals, as this can temporarily raise your blood pressure or heart rate and affect your exam. Now, here's the important thing. Don't forget to bring your glasses or hearing aids. Contrary to what used to be, nowadays you don't need perfect natural vision to fly, as long as you can correct them with lenses. And actually, for a third class, you don't need to have perfect vision at all. You only need a 20/40 vision for distance or for close, which is actually a low bar. Now, it's important to remember that the FAA does not allow different lenses in each eye. Now, I'm going to discuss with you what happens during the exam. Now, how is the exam performed and what happens during the exam? Here's what we usually test. When you get to the office, we'll check your blood pressure and your heart rate. We'll also test your urine. We're not doing a drug test. We're just testing for either protein or glucose, which is a sign of other diseases. My staff will also check your weight and your height. I then will chat with you, usually about airplanes, which is the fun part of this whole thing. And then I'll do a quick physical exam, and this includes checking your eyes, your ears, or check your neck and your axilla for lymph nodes. I'll then check your lungs by listening to them, or check your heart by listening to them as well. We'll do a quick neurologic exam to check reflexes and coordination. Regarding mental health, there is no formal psychiatric test that we do, but we'll discuss any history or symptoms related to that. And at last, we'll check your vision, and this will include tests for distance vision and near vision, as well as color vision, in some situations, intermediate vision. We also check your peripheral vision. Again, very important, if you use glasses, you have to bring them. As far as hearing, there is no specific test that we do, as long as you can carry a reasonable conversation. That's all that's required. And then hopefully when we're done with the exam, I can either print your certificate or I'll guide you through the next steps so you can go flying. Again, the goal of this process is not to ground you, but to ensure that you're medically fit to fly safely. And the key is, by preparing in advance and sharing any relevant medical information with me, we can work together to address potential issues and streamline the certification process. So let's do this. Complete your MedXpress application. Provide your medical history and medication details in advance, and bring any necessary documentation with you. If you have questions or need to discuss your medical history ahead of time, feel free to reach out and send me a message.